let's start our next organ. It is the uterus, and uterus, it is a pear-shaped organ, and its weight in the nulliparous women it is 50 gram, and in multiparous it is 70 gram, and at term the weight of the uterus alone is 1 kg. The measurements are 7.5 into 5 into 2.5 centimeter in non-pregnant state, and it consists of the fundus, the body, isthmus, and cervix. It is antifluxed or can be retroflexed, and the flexion of the uterus at the level is at the internal os, and it is usually 170-degree. Antiversion or the retroversion and axis of the cervix on the vagina, and it is usually 90-degree. Now relations, let's see first the relations of the uterus, and here there are the relations. On the anterior side of the uterus, there are the uterosacral or the pseudo-vesical pouch and the intestines and the superior surface of the bladder. On the lateral side, there is a broad ligament and ureter, and on the posterior side, the pouch of the Douglas and the intestines. Now, lymphatic drainage, and the lymphatic drainage around the fundus, they are by the round ligament to the inguinal node, and by the ovarian vessels to the para-aortic nodes, and around the body they are by the broad ligament of the external iliac nodes. Now, the uterus is made up of the three layers. These are the endometrium, myometrium, and perimetrium. Endometrium consists of further two layers, the functional layer and the basal layer. Cervical endometrium is not shed during the menstrual cycle. The myometrium is composed of three layers of the muscles, the inner circular, the middle oblique, and the outer longitudinal muscles. The perimetrium is made up of the peritoneum, and the nerve supply is by the sacral plexus, and the blood supply to the basal layer is the straight arterioles, and to the functional layer is the spiral arterioles. Now moving towards the cervix, epithelium, it consists of the supravaginal portion. It is there are the columnar cells, and the vaginal portion there are the stratified squamous cells, and the cervical mucosa displays are more vitae, the spin bucket, and the lymphatic drainage we have I'm going to discuss it in this box. The lymphatic drainage of the cervix on the lateral aspects, they are by the broad ligament to the external iliac node, and to the posterior lateral aspects, they are by the uterine vessels to the internal iliac nodes, and the posterior aspects are the sacral nodes. In the pregnancy, the lower segments of the uterus is composed of the ischium 70% and cervix is 30%. Internal os lies in the cervix, and the shortening of the upper segments is called the retraction. The decidua, it is the endometrium which is under the influence of the progesterone, has a high glycogen content, and they produce the prolactin and insulin like growth factor. The Braxton Hicks contractions, they can occur as early as 8 weeks, and the 25 millimeter of the mercury of the pressure is sufficient to cause the cervical dilatation. Now the fallopian tubes, they are 10 centimeter long, and they are composed of the isthmus, ampulla, and infundibulum. Isthmus is 2.5 centimeter, ampulla the longest and where there is fertilization occurs, it is 5 centimeter, and infundibulum is again 2.5 centimeter. Then it has the fimbria. It has 4 layers. They are lined by the ciliated columnar epithelium, the inner circular muscles, and the outer longitudinal muscles, and the peritoneum. Nerve supply is by the ovarian plexus. The uterine ligament, they consist of the broad ligament, is a double fold of the peritoneum. The round ligament, that runs from the corner to the labia majora, and cardinal ligaments, they run from the cervical to the lateral wall of the pelvic cavity, and the uterosacral ligaments, they run from the cervix to the periosteum of the sacrum, and the pubocervical ligaments, they run from the cervix to the pubic bone. In fundibulopelvic ligament, they are the poles of the broad ligaments. They extend from the infundibulum to the lateral wall of the pelvis, and they contain the ovarian vessels. Now moving towards the ovaries, they measure 3 to 1 centimeter, and they weigh 5 to 8 gram, and irregular surface and the almond shape, and they has 4 layers, the germinal epithelium, tunica, albuginea, and cortex. They contains ovarian follicles, and the medulla, they contains the vessels. Ovarian sports ligaments, they are the infundibulopelvic ligament. the broad ligament and the ovarian ligament. They are attached to the back of the broad ligament by the mesovarium, and they lie in the ovarian fossa, and nerve supply is by the T10, and the ovarian epithelium is cuboidal. Now the ovarian fossa, which is also known as the Walder's fossa, it is a shallow depression on the lateral wall of the pelvis, and it contains the obturator nerves, and the boundaries includes, on the superior side there is the external iliac vessels. On the anterior sides there are the obliterated umbilical artery, and the posterior the internal iliac vessels and the ureter. Now the breasts. They are the modified pseudophallus glands which produce milk, and they lies on the second to sixth rib and the serratus anterior, pectoralis major, and the rectus sheath. The structures, they have 10-20 lobules, and these lobules are drained to the nipple via the lactiferous ducts, and the ligament of the Coopers, they separates the lobules, and they run from the subcutaneous tissue to the fascia of the chest wall. The glands of the Montgomery, they lubricates areola, and they are modified sebaceous glands, and the tail of the spans is the superior lateral quadrant of the breast that extends towards the axilla. The blood supply of the breast, it includes the axillary arteries is by the lateral thoracic artery, and the acromiothoracic artery, and internal thoracic artery, and the intercostal vessels. The nerve supply of the breast is by the T4 to T6, and to the nipple it is T4. Lymphatic drainage, the axillary, parasternal, and the abdominal. Development from the ectoderm, and homologous male structures, and they are the Skene's glands, which is prostrate, and the bulbourethral glands, Cowper's, which is the Bartholin, and the prostatic utricle, which is vagina, and labia majora is the scrotum, and the clitoris is the penis. So these are the homologous male structures. Skene's glands are present in the males, while in the females, and while the prostate is present in the males. Here it is female, and here it is male. The bulbourethral gland, Cowper's, and it is Bartholin is present in the females, and the bulbourethral gland is present in the males. Prostatic utricle is in the males, and vagina in female, labia majora in females, and scrotum in males, and clitoris in females, and the penis in males. Penis. Now the next is the vascular tree, which is the first is the arteries, and the major branch is the aorta, and it gives off the different branches, which includes the inferior phrenic arteries, the celiac trunk, the suprarenal arteries, the superior mesenteric artery, the renal arteries, and the gonadal arteries, and lumbar four pairs, the lateral arteries, and the inferior mesenteric artery, and the median, also known as the middle or the sacral artery. It bifurcates at the L4 and into two common iliac arteries, and enters abdomen at the level of the T12. The common iliac arteries, they commence at the level of the L4 and they ends at the L5 and S1, and bifurcates at the sacroiliac joints, and relations of the celiac common iliac artery. Anteriorly they are the superior hypogastric plexus, and posteriorly there is the sympathetic trunk and obturator nerves, and the ilio-lumbar artery, and on the lateral they are the psoas muscles. And external iliac artery, the branches are the inferior epigastric artery and the deep circumflex iliac artery, and the relations, they includes, this is the external iliac artery. On the medial side there is the femoral main, on the lateral side there is psoas major, on the posterior there is psoas major, and on the anterior the ureter, the gonadal vessels, and the genital branch of the genitofemoral nerve, and deep circumflex iliac vein, and the round ligament. And now the internal iliac arteries, they are also known as the hypogastric arteries, and they arises at the bifurcation of the common iliac arteries at the level of the L5 and S1. These are the main arteries of the pelvis and they supply to the pelvic organs, the buttocks, and the middle compartment of the thighs. The relations of the internal iliac artery, it includes on the anterior there are the ureter, fallopian tubes, and ovaries. On the on the posterior sides there are the internal iliac vein. On the medial side there are the small bowel, and the lateral side the external iliac vessels, obturator nerve, and psoas major. Now they are divided into two branches at the margin of the greater sciatic foramen, and these are here the branches of the internal iliac artery. The branches of the anterior branch, they are the uterine, vaginal, vesical, umbilical, obturator, gluteal, rectal, and internal pudental. And the branches of the posterior branch, they are the iliolumbar and the lateral sacral and the superior gluteal. And the collateral circulations and is anastomosis. It occurs at the uterine and ovarian arteries and the middle rectal and the superior rectal arteries. It also occurs at the obturator and inferior epigastric, the medial circumflex femoral arteries, and the superior and inferior vesical arteries, and the profunda femoris and the inferior gluteal arteries. Superior gluteal and the lateral sacral arteries, the lateral sacral and the median sacral arteries, and the iliolumbar and lumbar arteries, and the iliolumbar and superior gluteal and the superficial uh, iliac circumflex arteries. Now the another major branch is the femoral artery, and the branches of the external artery, the root is of the femoral artery, it runs medial to the femur and they crosses by the adductor hiatus and they enter into the popliteal fossa and become the popliteal arteries and passes under the inguinal ligament. It lies in the femoral triangle and on the tendon of the psoas major. The branches of the femoral arteries are the profunda femoris, the superficial artery descending genicular, and the external pudental. The superficial artery is subdivided into the epigastric and the circumflex, and meanwhile external pudental as into the superficial and deep. Now the obturator arteries, and they arises from the internal iliac and anterior division, and rarely the external iliac, internal iliac, and posterior division, and the superior gluteal and the inferior epigastric. The root is they passes anterior inferiorly on the lateral wall of the pelvis to the obturator foramen, and they leave the pelvic cavity via the obturator canal, and they rarely passes lateral to the femoral ring and curve on the free margins of the lacunar ligament. The branches of the obturator arteries inside is the pelvis, and the outside the pelvis. Inside in the pelvis they are the iliac branch, the pubic branch, and the vesical branch. On outside of the pubis they are anterior and posterior. The branches of the obturator arteries here we have discussed here, and they communicates with the iliolumbar region, and here the relations, the obturator artery laterally they are the obturator fascia, and medially the ureter ductus deferens and the peritoneum, and on the inferior side they are the obturator nerve. Internal pudental arteries they supply the external genitalia, and they are the terminal branches of the anterior divisions of the internal iliac artery, and they're smaller in females compared to the males, and the root they exist wide the greater sciatic foramen, and they cover around the sacrospinous ligament, and they enter the ischoanal fossa via the lesser sciatic foramen, and they travels in the pudental Alcock's canal. The branches includes the internal pudental. They have the inferior rectal, perineal, the posterior labial, the dorsal artery of the clitoris, the deep artery of the clitoris, and the interior bulb of the vestibule. Now move towards the homologous male and the female structures. The vaginal arteries are in the females, and they are in the males they are present in the form of the inferior vesicles artery in the male, and the uterine artery in the female, and the middle rectal artery in the male. Now move towards the vascular tree, which is the vein. The most important is inferior vena cava, and the inferior vena cava, it commences at the level of the L5 and terminates at the level of the T8, and the relations of the inferior vena cava. Anteriorly, there is a root of the ileal mesentery, third part of the jejunum and head of the pancreas, bile duct, and the portal vein, and the first part of the jejunum, the posterior abdominal peritoneum, and the bare area of the liver. And on the posterior, the lumbar artery, the renal artery, the sympathetic chain, and the suprarenal gland, and the inferior phrenic artery. And now the condyle veins, they drains directly into the inferior vena cava. And now the greater saphenous vein, there is the large superficial vein and originates from the dorsal vein of the big toe. And the root, they passes anterior to the medial malleolus, and they runs over the posterior border of the medial epicondyle of the femur, and they injures the fascia lata via the saphenous opening on the anterior aspects of the thigh, and they join the femoral vein into the femoral triangle. It receives the tibial vein and the femoral vein branches, and the thoracoepigastric veins, they connect the femoral and axillary veins, and they runs lateral to the superior epigastric veins. Now the next system is the lymphatic system, and again it is very important. And let's discuss with the thoracic duct. It originates from the cisterna calli at the level of the T12, and it drains into the left subclavian vein, and the measures 45 centimeters. The right lymphatic ducts, they arises anterior to the scalenus anterior, and they drains into the right subclavian vein, and the measure is 10 millimeter. The drainage of the abdominal lymph glands, they are the pelvic nodes, the para-aortic nodes, and the cisternal calli, and the thoracic duct. Now let's move to our most important topic, and this is the neuroanatomy. For the MRCOG, we're just going to do the basics of the neuroanatomy and not in very detail, but we are going to cover very important and high yield topics here. Now starts with the brain. Brain consists of the four principal parts: the brain stem, which consists of the midbrain, the pons, and medulla oblongata, the cerebellum, and the dance phalon consists of the thalamus, hypothalamus, pineal gland, and the cerebrum. Cerebrum, it is the superficial layer of the gray matter, and is called the cerebral cortex, and consists of the gyri and the sulci, and corpus callosum is a white matter that connects the cerebral hemisphere. And each hemisphere is divided into four lobes: the frontal, parietal, temporal, and occipital. The precentral gyrus, located anterior to the central sulcus, is the primary motor area, and post-central gyrus, it is located posterior to the central sulcus and is the primary somatosensory area. Now the basal ganglia, they are the several groups of the nuclei in each cerebral hemisphere, consist of the corpus striatum, the substantia nigra, red nucleus, subthalamic nuclei, and corpus striatum is made up of the caudate nucleus and the lenticular nucleus, and the lenticular nucleus is made up of the putamen and the globus pallidus, and the cerebrospinal fluid, the circulates in the subarachnoid space, and there are the four cerebrospinal fluid filled cavities within the brain: the two lateral ventricles, third ventricle, fourth ventricle. The measurements total CSF volume, or the cerebrospinal fluid volume in the body, is 80 to 150 ml, and the rate of the production is equal to the rate of the absorption, which is 20 ml per hour. It is produced by the choroid pollicis and via the filtrations of the blood supply. Now the reabsorption occurs by the arachnoid villi in the superior sagittal sinus and the choroid plexus. Now the nerves, the number one is the cranial nerve. There are the 12 pairs, and somatic pathway, the somatic motor and the sensory pathway. We are going to first let's discuss the 12 pairs of the cranial nerve, and here they are the olfactory, optic, oculomotor, trochlear, trigeminal, abducens, facial, and the vestibulocochlear, and the glossopharyngeal, and the vagus, and the accessory, and the hypoglossal. They are the 12 pairs, and the olfactory, it is going to exist by the olfactory foramina, and optic is by the optic canal. The oculomotor, it originates from the midbrain and they runs by the lateral wall of the cavernous sinus and they exist by the superior orbital fascia. The next is the trochlear and it originates from the midbrain and runs by the cavernous sinus and exits by the superior orbital fissure. Similarly, the trigeminal, it originates from the pons and runs by the cavernous sinus and exits by the ophthalmic nerves, the superior orbital fissure, the maxillary nerve, foramen rotundum, and the mandibular nerve, the foramen ovale. Abducens is originates from the pons and also runs by the guanar sinus and exits by the superior orbital fissure. The facial nerve originates from the cerebropontine angle and runs by the internal acoustic canal and the facial canal and exits by the stylomastoid foramen. Similarly, the vestibulocochlear, it originates from the cerebropontine angle and exits by the internal acoustic canal. And the glossopharyngeal, it originates from the medulla and exits by the jugular foramen. Similarly, the vagus, it originates from the medulla and travels by the carotid sheath and exits by foramen, jugular foramen. And again with the SST, it runs by the foramen magnum and hence by the jugular foramen. And hypoglossal, it originates from the medulla, lies on the carotid sheath and exits by the hypoglossal canal. Now, the somatic pathway and the sensory pathway. The motor, it is the pyramidal tract and the extrapyramidal pathway. Sensory, the posterior column and the spinothalamic column. The spinothalamic tract, they formed by the neuron sets and the pseudo unipolar neurons in the dorsal root or ganglion. Tract cells, they are the secondary neurons in the substantia gelatinosa on the nucleus proprius. There are several nuclei in the thalamus, and the pathway desiccates at the level of the spinal cord in the anterior white commissures. Here it is the diagram of the somatic, motor and the sensory pathway in the spinal cord. This is the posterior column tract. This is again the posterior spinocerebellar tract. This is anterior spinocerebellar tract, and these are the lateral spinothalamic tracts. These are anterior spinothalamic tracts, and these are the anterior corticospinal tracts. This is anterior gray horn with the cell body of the motor neurons. This is the lateral corticospinal tract, the central canal, and the posterior gray horn. It consists of the two tracts, the lateral spinothalamic tract and the anterior spinothalamic tract, and the type of the impulse modality conducted is the pain, temperature, touch, and pressure. And here these are the pathways, and here it is somewhat clear. The spinothalamic pathway, it is by the spinal cord, then crosses the spinal cord, the spinothalamic tract, the thalamus, and the posterior central gyrus. The posterior column, also known as the dorsal column and medial lemniscus pathway, it is formed by the three neuron sets. The first set is the Meissner's capsules, the second set is the gracile and the cuneate nucleus, and the third set is the ventral posterior medial nucleus of the thalamus. The types of the impulse modality, they are conducted are the proprioceptions and the discriminative touch and the two-point tactile discrimination. It is by the pressures and the vibration. It is composed of the fasciculus gracilis and the fasciculus cuneatus. This pathway is tested with the Romberg's test, and the pathway is the spinal cord, then medulla oblongata, crosses medulla oblongata, the medial meniscus, and the thalamus, and the post-central gyrus. Now the corticospinal tract, it consists of the lateral corticospinal tract, which is 90%, and anterior corticospinal tract, which is 10%. Extrapyramidal pathway consists of the rubrospinal tract, the tactospinal tract, and the vestibulospinal tract. The spinal nerves, the meninges, are the connective tissues covering the brain and the spinal cord. And this is the pathway of the lateral corticospinal pathway, which is from the left precentral gyrus, then internal capsule, then 90% decussage in the medulla to contralateral sides, and the right lateral corticospinal tracts. And the anterior corticospinal pathway, they are the left precentral gyrus, then internal capsule, then 10% stay on the ipsilateral sides, and the left anterior cortical spinal tract. It is composed of the three layers, the dura mater, arachnoid, and the pia mater. The spinal cord, it extends from the medulla oblongata to the vertebral level in the adults at L1, and in the infants it is at the L3 and L4. Conus medullaris, it is the conical portions of the spinal cord. It ends at the L1 and give rise to the filum terminale. And the filum terminale is the extensions of the pia mater and ends at the coccus. And the cauda equina, the nerve root that arises inferior to the conus medullaris. The posterior space, that big dural space, it is between the walls of the vertebral canal and the dura. The subdural space between the dura and the arachnoid, and the subarachnoid space is between the arachnoid and pia mater. The spinal nerves, there are the 31 pairs of spinal nerve. 8 are cervical, 12 thoracic, lumbar 5, and sacral 5, and coccygeal is 1. They have two roots. The posterior, the dorsal root contains the sensory fibers, and the anterior ventral root contains the motor fibers. The posterior roots, they have a ganglion. The nerve plexus, the peripheral nerves, the nerve plexus, the cervical are C1 to C5, the brachial is C5 to T1, lumbar is T12 to L5, and sacral is L5 to S5. Now the lumbar plexus, they give rise to the iliohypogastric nerve L1, ilioinguinal nerve L1, and genitofemoral nerve L1 and L2, and the lateral femoral cutaneous nerve L2 and L3, and obturator nerves L2 to L4, and the femoral nerves L2 to L4. They originate from the anterior primary rami of the L1 to L4. They traverses the psoas major and emerges from its lateral border of the except of the obturator nerve emerges from the medial border, and the genitofemoral nerve, which emerges from the anterior aspects of the muscle. Now the iliohypogastric nerve, they originates from the anterior ramus of the L1, which also contains some fibers from the T12, emerges on the lateral border of the psoas major, and the perforates the transversus abdominis muscles. The branches, they are the lateral cutaneous and the anterior cutaneous. The communications with the ilioinguinal nerves, which also originates from the anterior rami of the L1, and the genitofemoral nerve emerges from the anterior surface of the psoas major. The branches of the femoral branch and the genital branch, and the femoral branch, they travels the lateral to the external iliac artery, the beneath the inguinal ligament. The genital branch, they innervates via the inguinal ring and the cremasteric muscles, the scrotum, mons pubis, and labia majora. Obturator nerve, they arises from the L2 to L4, emerges from the middle border of psoas major. The roots, they passes behind the common iliac vessels, the lateral to the internal iliac vessels and the urethra, and runs along the lateral wall of the lesser pelvis, and runs above and in front of the obturator vessels, and enters the thighs via the obturator canal, and divides into the anterior and posterior divisions. The branches, they are the anterior and posterior. The both anterior and posterior branches are divided by the obturator externus muscles and the adductor brevis muscles. Innervations are the medial aspects of the thigh, the knee joints, and the adductor muscles of the lower limb. And the adductor muscles of the lower limb innervates by the obturator nerve includes the external obturator, the pectineus, adductor longus, adductor brevis, and the adductor magnus, and the gracilis. Now the femoral nerves, the largest branch of the lumbar plexus, arises from the L2 to L4, emerges from the lateral border of the psoas major. The root passes between the psoas major and the iliacus muscles, and runs behind the iliacus fascia, and divides into the two divisions beneath the inguinal ligament, which straddle the lateral circumflex femoral artery. The branches are the anterior and posterior. The anterior femoral branch consists of the intermediate anterior cutaneous nerve and the medial anterior cutaneous nerve. The posterior femoral branch, they consist of the saphenous nerve, the vastus lateralis, and the vastus medialis, and the vastus intermedius, and the innervates the hip joint, the knee joint, and anterior compartment of the thigh. Anterior compartment of the thigh muscles innervates by the femoral nerve includes the quadriceps, the sartorius, and the pectineus. The saphenous nerve, the branch of the femoral nerve. The root is descending in the femoral triangle and ends the adductor canal. It continues with the long saphenous vein and crosses anterior to the medial malleolus where it is palpable, and the sacral plexus, it is the S1 to S4. They lies between the piriformis muscles and the pelvic fascia. In front of it are the iliac internal iliac vessels and the uterine sigmoid colon. They give rise to the superior gluteal nerve L4 to S1 and the sciatic nerve L4 to S3 and inferior gluteal nerve L5 to S2 and the posterior cutaneous nerve S1 to S3 and pudendal nerve S2 to S4. The posterior cutaneous nerve, it innervates the perineum skin of the posterior thigh and leg. The roots exist pelvis by the greater sciatic foramen and descends beneath the gluteus maximus with the inferior gluteal artery and run down the back of the thigh beneath the fascia lata and pierce the deep fascia at the knee and accompanies the small saphenous vein. The superior gluteal nerve, they innervates the gluteus medius and minimus and the tensor fascia lata. The root they leaves the pelvis by the greater sciatic foramen above the piriformis and accompanies the superior gluteal vessels. Inferior gluteal nerves innervates the gluteus maximus and they leave the pelvis via the greater sciatic foramen below the piriformis. Sciatic nerve, it is from L4 to S3 and the longest single nerve in the body, innervates nearly the entire skin of the leg and obturator internus, pars femoris, the semitendinous, the semimembranous, and the adductor magnus, and the hip joint. The root is it exists the pelvis by the greater sciatic foramen below the piriformis. It descends between the greater trochanter of the femur and the tuberosity of the ischium, and it divides at the level a lower one-third of the posterior thigh into two branches. The branches are the tibial, they passes through the popliteal fossa, innervates all the muscles of the foot except the external digitorum, brevis and knee joint, ankle joint, and skin over the lateral aspects of the foot. The branches are the sural nerve, which provides the cutaneous innervations, and the plantar nerves. The fibular or the common peroneal divides into two branches. The deep innervates the extensor digitorum brevis and the superficial, and the division they can uh, take place from any point between the sacral plexus to the lower one-third of the thigh. It is accompanied by the posterior femoral cutaneous nerve and the inferior gluteal artery and the crossed by the long head of the bicep femoris and the covered by the gluteus maximums. Now the pudendal nerve, they arises from the S2 to S4 and they passes between the piriformis and the coccyx muscles. They leaves the pelvis by the greater sciatic foramen and they crosses the ischial spines and they re-enters the pelvic via the lesser sciatic foramen and they run along the pudendal vessels in the ischio-rectal fossa and it contains the obturator internal fascia called the pudendal Alcock's canal. The branches are the inferior anal nerve, the perineal and the dorsal nerve of the penis or the clitoris. It innervates the penis, scrotum, clitoris, bulbus spongiosus, ischio-cavernous, and the anus. Now the autonomic nerves. The autonomic plexus is a celiac which is formed by the celiac ganglia, that is supplied by the greater splanchnic nerves and the vagus nerve and the superior mesenteric. And also the aorta, inferior mesenteric, and the superior hypogastric, they lies at the bifurcation of the aorta and inferior hypogastric. The two plexus, they each located on the either pelvic side wall, and together they form the pelvic hypogastrium plexus. And splanchnic nerves, the preganglion sympathetic fibers, they form the greater splanchnic nerve and lesser splanchnic nerve and the least splanchnic nerve and the lumbar splanchnic nerves and the sacral splanchnic nerves. The preganglion or the parasympathetic fibers, they form the pelvic splanchnic nerve which joins the inferior hypogastric nerve. The pelvis splanchnic nerve, they also known as the nervi aeruginates and located on the sides of the rectum and provides the motor innervation to beyond the left one-third of the transverse colon, the uterus, and the bladder. The provided sensory innervation to the bladder, urethra, rectum, anal canal, cervix, upper vagina, and prostate. Inferior hypogastric postganglionic sympathetic innervation, the motor are the seminal vesicles, the prostate, anal sphincter, and the urethral sphincter, the sensory of the upper rectum and the body of the uterus. Now let's move towards the endocrine anatomy. The first is the hypothalamus. It is located below the thalamus and above the brainstem. They form the floor of the third ventricle, and it includes, this is a diagram of the nervous plexus pathway. So let's continue with the endocrine anatomy. The hypothalamus includes the optic-chiasma, the tubercularium, and infundibulum stalk, and mammillary bodies, and the posterior perforated substance, and has two portions, the posterior medial and the anterior lateral. Now, the pituitary gland, it is also known as the hypophysis, and it is pea-sized, and it sits on the sella tracheica, the pituitary fossa in the sphenoid bone, and covered by the dural folds and the sella diagram, and has three parts. The anterior lobe, adenohypophysis, develops from the left expulsion, the posterior lobe, the neurohypophysis, and the pars intermedia. They develop from the exoderm. The borders of the pituitary, on the above there is optic chiasma, below there is sphenoid bone, and the lateral there the cavernous sinus on the both sides. The blood supply to the interior pituitary lobe is via the infundibulum, and the vascular network of the anterior pituitary includes the internal carotid and posterior communicating artery, the superior hypophyseal artery, and they forms the primary plexus at the base of the hypothalamus, and the hypophyseal portal vein, and they forms the secondary plexus and the anterior hypophyseal vein. The blood supply to the posterior pituitary, they include is by the internal carotid artery, inferior hypophyseal artery, the plexus of the infundibular process, and the posterior hypophyseal vein. The anterior lobe, it consists of the three cell types, the chromophobe, the eosinophilic, and the basophilic. Adenohypophysis, they secrete 6 hormones. These are the gonadotropins, FSH and LH, and the prolactin growth hormones, thyroid stimulating hormone, adenocorticotropic hormones, and the melanocyte stimulating hormone. The neurophysis stores and secretes 2 hormones which are produced by the hypothalamus, which is the oxytocin and antidiuretic hormone. The pineal gland, it secretes the melatonin and often calcified, attaches to the roof of the third ventricles. They are covered by the capsule formed by the biomatter. The thyroid gland, it is the first endocrine organ to appear at the day 24 of the embryonic development. It weighs 30 gram, and blood supply is equal to 120 ml per minute. Arterial supply is superior thyroid, which is a branch of the external carotid artery, the inferior thyroid, which is a branch of the subclavian artery, and the thyroidema, which is a branch of the aortic arch and the brachiocephalic artery. The venous drainage is to the superior thyroid, it drains through the internal jugular vein, the middle thyroid, it drains through the internal jugular vein, and the inferior thyroid drains through the left brachiocephalic. It is made up of the isthmus, which is overlying second and third tracheal ring, and the lateral lobes extends to the sixth tracheal ring, and the parametal lobes, also known as the Lelute pyramid. It encloses in the pretracheal fascia. The thyroid follicles, they contains the 2 cells, the follicular and the parafollicular C cells. 3 principal hormones are secreted: the thyroxine, T4, triiodothyronine, which is T3, and the calcitonin. They form the C cells. The relation: the thyroid anteriorly, the strap muscles, the sternocleidomastoid, and anterior jugular vein. On the posterior sides, there is the larynx, trachea, and carotid sheath. Now moving towards the parathyroid glands, they are usually 4 in number, 10 gram each, and it is also pea-sized and the yellowish brown in color, and it contains the 2 cell types, which are the chief and the oxyphilic. The carotid sheath, it extends from the base of the skull to the first rib, and the sternum contains the internal carotid artery, internal jugular vein, vagus nerve, and deep cervical lymph node, and the nerves that pierce the sheath are the glossopharyngeal, SS3, and the hypoglossal. The suprarenal adrenal glands, they lie above the kidney. They measure 3 cm or 5 cm, and they weigh about 5 gram. They has 2 regions. The cortex, they are derived from the mesoderm and they subdivide into three zones. The medulla, they derive from the ectoderm and they contains the chromaffin cells. And adrenal cortex zones, they are the zona glomerulosa secretes the melanocorticoids, the zona fasciculata secretes the glucocorticoids, and the zona reticularis secretes androgens. Chromaffin cells, they are the sympathetic post ganglion cells, and they secretes the catecholamines, adrenal, epinephrine, and the non-epinephrine. And the blood supply is the renal artery, phrenic artery, and aorta. Venous drainage includes the right suprarenal drain into the inferior vena cava and the left suprarenal drains into the left renal vein. The fetal adrenal, they produce the surfactants, and the nerve supply is why the receives the preganglionic sympathetic fibers and no parasympathetic supply. And here comes our good news. This is the last topic of the chapter. It is the fetal skull. And the fetal skull bones, they are 9 in number, and 2 are frontal, 2 parietal, 2 temporal, 2 sphenoidal, and 1 occipital. The fetal skull sutures, they are 8 in number: 1 frontal, sagittarial, coronal, 2 lambdoidal, and 2 squamous. The fetal skull fontanelles, they are 6 in number: anterior fontanelle, posterior, sphenoidal, 2 are sphenoidal, and 2 are mastoid. The desiccation, the vertex, is the area which encompasses by the anterior fontanelle, posterior fontanelle, and the 2 parietal eminences. And the occiput is behind the posterior fontanelle, and sinciput is the area in front of the anterior fontanelle divided into the brows and face. And brows is the area above the nose and root of the nose, and face, it is the area below the root of the nose. The dimension, now these diameters are very important. The biparietal diameter is 5 centimeter, the bitemporal is 8.5 centimeter. The suboccipitobregmatic, the presenting in an occipital position, is 9.5 centimeter. Occipitofrontal, presenting in the vertex position, is 11.5 centimeter, and the mento vertical, which presents in the brows position, is 14 centimeters, the largest diameter. And submentobregmatic, presenting in the face position, is 9.5 centimeter. The circumferences, the suboccipitobregmatic into biparietal, the presentation in the vertex position is 28 centimeter, and the occipitofrontal and the biparietal is the 33 centimeter, and the mento vertex and the biparietal, it is 35.5 centimeter. Now the fetal skull fontanelle is anterior, the bregma, the bounded by the frontal and the parietal bones, and the diamond shaped and closes at the 18 months of the life. The posterior date is bordered by the parietal and occipital bone and closes at the 2 months of the age. And sphenoidal, the anterolateral, the bordered by the frontal, parietal, temporal, and the sphenoidal bones, 1 on the each side. The mastoid, the posterior lateral, the bordered by the parietal, temporal, and the occipital bone, 1 on each side. So this concludes our chapter number 3, which is anatomy. I will highly appreciate if you just comment if this reading of the topic is enough for you people, or you need me to explain the things. Kindly do comment in the comment box, like this video, and share with your friends.